The Government Employees Medical Scheme's annual symposium is currently underway in Cape Town. The two-day gathering aims to inspire strategies that will contribute to the global pursuit of comprehensive and inclusive health coverage. Watching those developments is SABC News reporter Lulama, Matya, who joins us now live from where the symposium is taking place. And no overstating, Lulama, how important it is to speak about efficiencies in the health sector. What's come out of the symposium so far?
Good morning and welcome to Cape Town at the Century City Conference Centre. The annual GEMS Symposium has opened. The Minister of Public Service and Administration, Inkosi Butelezi, officially opened the event, making a speech highlighting the importance of a universal health coverage. We know that, that before the 7th administration began, President Cyril Ramaphosa signed the NHI into law. Well, the minister even here spoke about the importance of the NHI, saying that those who are opposed to it, it's because they lack information, because it's the universal health coverage is important to bridge the gap between the private and the public health and the gap between the haves and the have-nots. So he was saying that it's important for the NHI and also urging GEMS administrators that they should be also looking into that, in that the debates and deliberations that are going to happen today, they should be focusing towards a universal health coverage, indicating that at this day and age, with the challenges that the health system is facing, it should not be set aside for the privileged. Everybody should be able to access quality health care, Ayanda.
Absolutely. And perhaps you can also take us through who else we might be expecting to hear from at the symposium, given the fact that, of course, that GEMS has such a wide coverage, at least amongst public servants in the country.
Well, Ayanda, let me start by saying that the GEMS has over 2.3 million beneficiaries. Those are the employees of the public sector or government, we can say that. The speakers that are going to speak today include former Minister Geraldine Fraser-Moleketi. She's one of the trustees of GEMS. She's going to be speaking about also the importance of this universal coverage. She, in her speech, Ayanda, we're expecting also to touch on the background of why there is importance of a universal health coverage. She's also going to look at the history of this country. We know that, Ayanda, previously, under the apartheid government, how medical aids were conducted before this. There was GEMS, that the certain races, there was a medical aid for white people, for Indians, for coloreds, and then for blacks. And then after some time, after transformation in the sector, then there was this GEMS was established. She's expected to touch into those areas. Also, some of the people that are expected to speak here besides the minister, the Deputy Minister of Public Service and Administration as well, Pinky Kekana, is here. She's also going to speak on this universal coverage, because the important thing about even the theme of this symposium, Ayanda, it's towards a universal coverage for all. And the government now is creating awareness and also trying to allay the fears of the NHI, Ayanda, because the minister in his speech, he did mention that those who are opposed to the NHI, it's because of lack of information. And I guess, Ayanda, we can say that is why the president has opened a way for people to be consulted, for consultation to happen around NHI, so that those who have fears and those who are opposed to NHI can be brought on board, so that going forward they know why they should be this NHI, which is said to be bridging the gap between the public and the private healthcare.